Group 2 case reports. Members.
Hi, I'm Rana, your first aider, and we're going to talk about sunburn.
What is sunburn?
Sunburn is the skin's reaction to too much exposure of the skin to ultraviolet radiation from the sun.
Signs and symptoms.
Red or purple skin, swollen skin, warm or hot skin, blistering of the skin, nausea and vomiting, headache and fever.
Sunburn causes.
The cause of sunburn is that too much exposure from the sun or from ultraviolet radiation, or UV rays.
Pathology.
Pathology. The direct damage to DNA by UVR resulting to inflammation and apoptosis to the skin cells.
What should we do as a first aider?
Hey, are you okay?
Yes, but I'm having a sunburn.
Check for reddening of the skin, pain in the area that has been burnt, blisters. Encourage them to take sips of cold water. Cool the area down by sponging them with cool water or soothe them. Sore skin in a bath or shower. If blistered, use calamine lotion. Or after sun. If blistered, seek medical advice.
Thank you.
Hi, I'm Rowelyn Salis, your first aider. Today, we're going to talk about what is a snake bite.
A snake bite is an injury caused by the bite of the snake. Snakes have venomous fangs that can inject toxins into their prey or potential threats. The severity of a snake bite can vary depending on the species of snake, the amount of venom injected, and the location of the bite on the body.
Sign and symptoms, clinical manifestation.
There are some common signs and symptoms in snake bite, including pain and swelling, fang marks, redness and bruising, nausea and vomiting, weakness and dizziness, difficulty breathing, rapid pulse, blurred vision, paralysis or muscle weakness, and unconsciousness.
Causes.
The causes of snake bite include defensive bites, surprise encounters, handling snakes, disturbing snake habitats, provocation, accidental contact, feeding or handling pet snakes, protecting eggs or young, unintentional encounters in the wild.
Pathology. Pathophysiology.
The pathology of snake bites involves the study of the effects of snake venom on the human body and the resulting of physiological changes. Here's the pathology of snake bites: venom composition, hemotoxic effects, neurotoxic effects, local tissues damage, systematic effects, immune response, diagnostic challenges, and treatment.
What we should do as a first
Hey, are you
aider.
okay? I'm Rowelyn Salis, your first aider. Please calm down, ma'am.
Keep the victim still. Positioning the victim. Do not cut and suck the wound. Clean the wound and cover the bite. Monitor the vital sign and keep the records.
Good morning, everyone. I'm Michael Amora. Today, I'm going to discuss about what is swallowed poison and food. Poisons are substances that cause damage if too much is absorbed by the body. Swallowed poisons include chemical, fungi, and berries. Signs and symptoms: nausea, vomiting, diarrhea, rash, redness or soreness around the mouth, dry mouth, drooling or foaming at the mouth, trouble breathing, dilated pupil, or constricted pupils. What are the causes? The cause are swallowing, inhaling, touching, or injecting various drugs such as chemicals, venom, or gases. What are the pathologies? Pathologies are to initiate the poisoning, the organism is exposed to the toxic chemicals. When the toxic level of chemicals is accumulated in the cells of the target tissue or organ, the resultant injury of the cells disrupt their normal structure or function. Symptoms and toxic signs then develop, and if the toxicity is severe enough, death may result. Yeah.
Find out what type of toxic product has been ingested. If the casualty having trouble of breathing, sit them down. Or help them to aim breathing. Call the emergency services. Give them the information you have and follow the instructions.
Hi, today we're going to discuss about chemical burn. Chemical burn are a tissue damage caused by a straw and acid strain, cleaners, maintainers, gasoline, and many other substances. Usually, you are aware of such a burn and its cause, but sometimes you may not immediately recognize a burn caused by a milder chemical. Signs and symptoms of chemical burn: redness, irritation, or burning or a site of the contact. Pain, numbness at the site of the contact, formation of the blisters or black, dead skin at the contact site. Vision changes if the chemical gets into your eyes. Causes of chemical burn. Most chemicals that cause burns are either strong acids or bases. A glance of the medical information on the labels of dangerous chemicals confirm the expected toxicity. Common sense precautions in consumer education can reduce your family risk of injury. A variety of household products can cause chemical burns, including battery acids, bleach, concrete mix, drain or toilet bowl cleaners, metal cleaners, wall chlorinators, and cloth whitening products. The pathology of chemical burn or severe burns introduce responses that affect almost every organ system. Inflammation, hypermetabolism, muscle wasting, and insulin resistance are all hallmarks of the pathological response to severe burns, with changes of metabolism known to remain for several years following injury. Superficial or first-degree burn are only affect outer layer of the skin called epidermis. The area will be red or painful, but there usually is no permanent damage. Partial thickness or second-degree burns extend into the second layer of the skin called the dermis. You may have blisters and swelling, and it may leave. Full thickness or third-degree burns go through the skin and may damage tissue underneath. The area may look black or white. Because nerves are destroyed, you may not feel pain. Our first aid intervention and the chemical burn. Remove yourself or the person with the burn from the accident area. Remove any contaminating clothing. Wash the injured area to the dilute or remove the substance using large volume of water. Wash at least 2 minutes, taking care not to allow runoff to contact unaffected parts.
Hi, I'm Rosjin Bube, your first aider, and I'm going to talk about inhaled burns.
What is inhaled burn?
Inhaled burn typically refers to injured or damage caused by inhaling hot gases, smoke, or toxic fumes during fire or other situation involving heat or combustion. This burn can affect the respiratory system and may lead to serious health complications.
Sign and symptoms.
Coughing, shortness of breath, voice change, wheezing, chest pain, salt in nose or mouth, nasal discharge, headache.
Inhaled burn causes.
Causes of inhaled burn: smoke, fires, explosion, gas leak, car accident, household fire.
Pathology.
Pathology about inhaled burn is typical assessed through clinical evaluation, medical imaging such as X-rays or CT scan, and in some cases, we directly visualize and assess the extent of injury. Treatment may involve airway management, oxygen therapy, mechanical ventilation, and medication to reduce inflammation and manage complications.
What What should I do as a first aid? Ensure
Hey, are you
protocol for
okay?
helping
I'm
keep
Roslyn
fresh air
Guba, your
and
first
breathing.
aider. May I help you?
Provide oxygen-loosened clothing, keep the person calm, monitor
What
vital
should I
signs,
do at
do
first
not
aid?
offer water.
Drowning.
Hi, today we are going to discuss the first aid interventions about drowning.
What is drowning?
Drowning is a process of experiencing respiratory impairment on submersion or immersion in a liquid medium.
Sign and symptoms, clinical manifestation.
The signs and symptoms are clinical manifestations: persistent coughing, difficulty breathing, tiredness, decreased activity, blue color on skin and lips, loss of consciousness. After rescue, anxiety, vomiting, wheezing, and other consciousness are common. Patient may have respiratory failure with tachypnea, intercostal lip fraction, or cyanosis. Respiratory symptoms are sometimes delayed for up to 8 hours after submersion.
Causes?
What are the causes? Not being able to swim or lack of swimming ability, lack of close supervision, not wearing life jackets, drinking alcohol, or using drugs and prescription medication.
Pathology, pathophysiology.
Drowning is a diagnosis of exclusion based on ruling out all other causes of death by a complete autopsy and toxicology. May also see bloody clot in the airway, water in the stomach, cerebral edema, ruptures or mastoid hemorrhage. Thus, pathophysiology. Drowning causes hypoxemia, loss of consciousness, apnea, and ultimate cardiac arrest. Fluid respiration result in lung injury and acute respiratory distress syndrome.
What we should do as a first aider.
Now, let's cover rescue breathing for the victim.
So we had this victim fall out of the water and the area is safe. We need to assess to know if we give them full CPR or just rescue breathing and ask for specific person to make an emergency call. Hand on the forehead and tilt the head. Tap on the collarbone and not responding. Assess the patient for their needs. Check to feel the carotid pulse and move closer to feel the breathing. When pulse is present and no breathing, we need to do a rescue breathing. Normally with no breathing, they may be bluish, blue around the lips. To do rescue breathing, 1 breath every 3 seconds for 2 minutes. After 2 minutes, reassess the carotid pulse. If still there, continue to do rescue breathing. When theirs is no pulse and no breathing, proceed to CPR. Thank you for watching.
Sprain and strain.
The case that I'm going to report is about sprain and strain.
What is sprain and strain?
Sprain is an injury to ligament. The most common location for a sprain is the ankle joint, while strain is an injury or overstretching or tearing of muscles. The most common locations for a muscle strain are the hamstring muscle, cuff, and the lower back.
Signs and symptoms.
Symptoms of sprain and strain are very similar. That's because the injuries themselves are very similar. This includes pain around the affected joint, swelling, limited flexibility, difficulty using the joint's full range of motion. In sprain, there is bruising around the affected joint, while in strain, there is spasms in the affected muscle.
What are the causes of sprain and strain?
Certain situations make you more likely to injure your joints. This includes athletic activities or exercise, including running or jogging, accidents such as falling or slipping, lifting heavy objects, overexerting yourself, sitting or standing in an awkward position, or prolonged repetitive motion.
Pathophysiology of sprain and strain.
Pathophysiology of sprain. The most common causes of sprains are falling, twisting, or experiencing trauma to the joint. These types of injuries may cause the joint to move out of its normal range of movement, tearing or stretching the ligament. The pathophysiology of strain. A strain occurs when muscle fibers can cope with the demand placed on them by activity overload and leads to tearing of the fibers. It is a contraction-induced injury in which muscle fibers tear due to extensive mechanical stress.
What should we do as a first aider?
Hey, are you okay? I'm Janet, your first aider. May I help you?
Elevate the affected area to reduce swelling. Apply ice right away for 10 minutes to reduce swelling and bruising. Apply a compression elastic bandage or triangular bandage. This will help to continue to reduce swelling and limit mobility. And check the toes frequently. You'll make sure circulation is not cut off. Have the victim rest to not cause further injury and until medical help arrives. It is important to follow the 4 steps RICE protocol for both sprain and strain to reduce swelling and relieve pressure on the affected area. RICE, rest, ice, compression, elevation.
First aid save lives.